Solihull Approach opens up people to be able to think for themselves, to come up with their own solutions. Solihull Approach offers respect for someone's ability to think autonomously. If we can help them regulate and move into a space where they can genuinely reach, where they can reflect and reach their prefrontal cortex. Doing lots of things in Australia now. We've run training for managers, we've run training for mental health nurses, for perinatal mental health workers, for university students, for midwives, maternal and child health nurses. A range of trainings have been available. We've got family groups up and running, and now we've got the cascade model where trainers are training within their organisations, which excites me enormously. I see a repeated pattern of way Solihull makes a difference. For practitioners, I see them become more satisfied in their work. They feel more empowered themselves. They feel like they're supporting people they work with, their growth and their own development, as opposed to telling them what to do. It's got this dominoes effect. Whatever people experience, they're then able to replicate for other people, which means staff, managers, first line responders. It affects so many people in the same way. It frames thinking so that it enables others to both self-regulate, but to also come up with their own, which means people are owning their own outcomes. We can support them in that enormously. And we can also watch people grow and believe in themselves. And that's something that the Solihull offers as an internal experience, to trust in a way of thinking that supports you in the way you grow and you think, and then support others. I did a Zoom consultation with a woman today who was looking to change her child's experience and her own. They were both quite dysregulated and had been under the care of many, many different service providers. And what happened was she was able to say, after we didn't do a lot, I did a lot of Solihull thinking, but she actually said, "Why hasn't anybody told me this?" My response was really simple, was I didn't tell her anything. I didn't tell you anything. You came up with it. This is yours. You came up with it, and I'm really happy to support you with it. We know the impact of the early years. We know how significant it is, those experiences are, and how we can be part of someone's present, but also their future. We can make a difference, and a significant difference. So what I hear back frequently from those who have done the Solihull approach, and from a personal experience, is that it provides a navigational tool to structure thinking, to help navigate through the difficult conversations, to help others reach their potential. It's such a clear structure to frame thinking. It's a thinking framework.